Pancreatitis and anemia, what you should know. Hello, I'm Kevin Walton, a senior clinical nutritionist at Massachusetts General Hospital, and I primarily work as a dietitian for individuals with complex pancreatitis, as well as those who have had GI or trauma surgery. In this Mission Cure video, we will cover what is anemia, why are iron, vitamin B9, also called folic acid, and B12 important for our health, the different types of anemia, sources of these micronutrients, causes of anemia, who's at risk and why, symptoms to keep an eye out for, diagnosis, including evaluation and testing for different types of anemia, treatment and monitoring, and resources to learn more. What is anemia? Broadly speaking, anemia is a condition where the body does not make enough healthy and well-functioning red blood cells. One of the main jobs of red blood cells is to carry oxygen from the lungs to every part of the body and bring carbon dioxide from the tissues back to the lungs so it can be exhaled. To do this, red blood cells use a special protein called hemoglobin, which acts as the backbone for red blood cells. Iron is a key part of hemoglobin as it helps it bind to oxygen, and without enough iron, red blood cells can't transport oxygen as efficiently. For the body to make enough healthy red blood cells, vitamin B12 and folic acid are also essential. Vitamin B12, also called cobalamin, helps makes the building blocks for DNA and protein synthesis. If someone doesn't get enough B12, their body can't make enough healthy red blood cells. But luckily, a well-nourished person has about a year's worth or more of B12 stored in their liver. Vitamin B9, also called folate or folic acid, which I will use interchangeably during this session, is also needed to make DNA, as well as certain amino acids and fats. This is especially important when new red blood cells are being formed. Without these vitamins, red blood cells can't be formed properly and won't be able to carry as much oxygen, no matter how much iron you have. Iron, vitamin B12, and folate all work together to help your body make healthy red blood cells that can carry oxygen where it's needed most. If you are low in any of these nutrients, your body may not be able to make enough healthy red blood cells, or they might not work properly. Anemia can present differently based on what deficiency is driving the condition. Anemias can be classified and described by certain features, like the size and the appearance of red blood cells. Microcytic is a term that refers to the red blood cells being smaller than normal, while macrocytic means the red blood cells are abnormally large or swollen. Hypochromic means they are paler or not as red as normal. Sources of iron. We typically get iron from both plants and animal sources, like red meat, poultry, fish, beans, lentils, or other fortified foods. Food labels are required to report the content of iron, so reading them may be helpful. Iron from animal sources, also called heme iron, is typically absorbed more efficiently compared to plant-derived counterparts called non-heme iron. Causes of anemia. The general causes of anemia include nutritional deficiencies from inadequate or restrictive intake of certain micronutrients, specifically iron, B12, folic acid, or vitamin B9, but also copper and zinc can impact the development of anemia, but are less of a frontline factor. Malnutrition or decreased appetite and/or restricted diet can also be a cause of anemia. Malabsorption due to exocrine pancreatic insufficiency, often labeled EPI, or underdosed pancreatic enzyme replacement therapy, or PERT, can cause anemia, as well as malabsorption from inflammatory bowel diseases, ulcerative colitis, celiac disease, or those with past gastrointestinal surgeries like gastric bypass or other small bowel resection. Blood loss is another common cause for anemia, including menstrual blood loss, gastrointestinal bleeding like ulcers, polyps, or tumors, or from surgery. Chronic diseases can cause anemia, most commonly those of kidney and liver diseases, but also other conditions like alcohol abuse or vulnerable populations like those who are pregnant, young children, or older adults are also at risk for developing anemias. Who's at risk and why? Individuals with recurrent acute, chronic, complex pancreatitis, those with a concern for malabsorption, and those with EPI who may be taking pancreatic enzyme replacement therapy are all at risk for developing various types of anemias. Additionally, those with a history of kidney disease, women, including those who are pregnant, those with extensive gastrointestinal surgical history or inflammatory bowel disease, those who have had alcohol use disorder, those with cancer, are all at risk for developing anemias. Lastly, strict vegetarians and vegans may also be at risk for anemias. Since there are many potential etiologies or reasons for the development of an anemia, like the ones we discussed above, it may be difficult to fully pin the cause of an anemia to pancreatitis. With that being said, chronic and untreated malabsorption, or EPI, from pancreatitis may put someone at risk for the development of an anemia. But reassuringly, there is blood work and certain tests that can be used to evaluate anemia, which we will review soon. Symptoms to watch. Signs and symptoms of anemia may be difficult to identify, isolate, and trend as they are nonspecific and have much overlap with other pancreatitis complications such as EPI and malabsorption. Common signs and symptoms of anemia are fatigue, shortness of breath, headaches, irregular heartbeat, jittery legs, and/or dizziness. Additionally, an unexplained pale complexion or appearance may be concerning for anemia. These symptoms overlap with EPI and may be happening concurrently. If you have any of these listed symptoms or concerns, you should talk to your doctor about being tested and treating for these known deficiencies. Diagnosis. Anemia is broadly diagnosed when the number of red blood cells, often labeled RBCs, fall below a normal reference range. And serum red blood cell tests are used in conjunction with hemoglobin and hematocrit tests to help further investigate. Other blood tests can help define and classify different types of anemias. Iron studies that typically contain a serum iron level, total iron binding capacity, transferrin saturation, and/or ferritin can be helpful in determining an iron deficiency anemia. While serum B12, folic acid, also called vitamin B9, erythrocyte folate, serum homocysteine, and methylmalonic acid levels all may help determine the presence of a macrocytic anemia. It is important to complete a workup for both folic acid and B12 since one of the deficiencies might mask the other. A routine part of blood work that assesses for anemia also contains a test called mean corpuscular volume, or MCV, and this test helps determine the size of the red blood cells. And this may help determine the classification of anemia as well as subsequent treatment. There is no general and widespread consensus, but it may be reasonable to have these tests done if there is a concern for EPI, newly starting pancreatic enzyme replacement therapy, after any period of unintentional weight loss of greater than 5 to 10% of your usual body weight, or for those who are experiencing any of the aforementioned symptoms that are unexplained. The frequency of reassessment is very patient-specific. If you are in generally good health, yearly monitoring may be sufficient. But if you are found to be deficient or depleted in certain micronutrients and have completed a repletion course without improvement in your anemia-related symptoms, it may be reasonable to repeat some of these tests. If you have recurrent acute pancreatitis, chronic pancreatitis, or have one or more symptoms discussed in our other related videos, you should talk to your doctor about being tested for these known deficiencies at least yearly intervals. Treatment and monitoring. If there is a concern for iron deficiency anemia, animal proteins contain the most bioavailable and readily absorbed form of iron. Luckily, these same foods, plus most dairy and eggs, also contain vitamin B12 if there is a concern for deficiency. Beans, lentils, and some fortified foods may also contain iron, but are in forms that are less bioavailable and readily absorbed when compared to their animal protein counterparts. Fruits, beans, and leafy greens are good sources of folate or folic acid. Some foods are fortified with iron and folate, so checking the nutrition label might be insightful. Always check with your medical provider before starting any repletion or supplementation, as treatment can be highly individualized. Various recommendations exist for the treatment of iron deficiency anemia, but 324 or 325 milligrams of iron sulfate daily may be reasonable if there is a concern for iron deficiency anemia. If having adverse gastrointestinal symptoms with daily administration is happening, taking it every other day may be just as effective. IV iron is highly specialized and should definitely be reviewed with your medical provider. For B12, in those without a history of gastrointestinal surgery, 1,000 micrograms of B12 orally every day for 1 to 3 months may be reasonable for those found to be deficient in vitamin B12. While the dosage and frequency may vary, intramuscular shots or nasal sprays may be better options for those with a prior history of gastrointestinal surgery or those who have not improved with standard oral repletion. For folic acid or vitamin B9, in those without a history of gastrointestinal surgery and those who are not pregnant, 1 to 5 milligrams of oral folic acid every day for 3 to 4 months may be a reasonable repletion course. For iron, tablets are typically encouraged as gummy vitamins might not contain iron. For vitamin B12 and folate, oral repletion is a suitable option for most people. Absorption of iron is best when taken on an empty stomach, but it may also worsen gastrointestinal side effects, including nausea, vomiting, and/or constipation. It's recommended to avoid taking any nuts, legumes, whole grains, or tea and coffee with oral iron supplementation. But conversely, taking any acidic beverage like orange juice or other juice with vitamin C may aid in the absorption of taking iron tablets. It's always important to consult with your primary physician and registered dietitian nutritionists to consider the suitable diet and dosage requirements for your specific needs. Resources to learn more. In our other videos, learn more about checking for vitamin and mineral deficiencies and the recommended treatment. In Mission Cures related videos, you can learn how to manage your nutrition needs and understand EPI and PERT dosing for proper nutrition and absorption. And thanks so much for watching.